Hello and welcome to this week's episode of Giant's Healthy Innovators TV. I'm your host. My name is Barry Shrier from Giant Health. We are a global community of everybody whose business is healthcare, technology, and innovation. We'd like to thank all of our listeners from around the world and our viewers. And if you like these videos, please remember to like and subscribe. And we'd also like to remind you that every year we produce a Giant Health event, which this year is on the 4th and 5th of December in London, England, at the Business Design Center. If you'd like more information, please go to www.giant.health. So every week, we're very, very pleased to bring you very interesting leaders in healthcare and tech and innovation to talk about some of the greatest challenges in healthcare and some of the greatest opportunities that innovation and new technology can be used to introduce to address these healthcare challenges. So today, really happy to have Chris McCourt from My Language Connection and Kim Somerville from Magpie. Nice to see you guys. Hello, Chris. How are you today?
I'm doing great, Barry. Thank you for having us.
Excellent. Yeah, nice to see you and really glad you could join us. And likewise, hi, Kim. Thank you for joining us. How are you?
Hi, Barry. Great. Thank you. Thanks for having me.
Good stuff. So we'll begin by just asking you guys briefly to introduce yourselves. And then obviously we have some big subjects in the world of healthcare and innovation that we'd like to talk about and hear about how you are successfully addressing those. So Chris, to begin with, if you don't mind, just a short introduction, please.
Yeah, of course. Thank you, Barry. So my name is Chris McCourt. I'm the head of Life Sciences Partnerships here at MLC, My Language Connection. We're a specialist translation provider focused on healthcare, so medical device companies, pharma companies, as well as the public sector and healthcare as well. So supporting language requirements there, and based in sunny Glasgow.
Excellent. Thank you. And again, Chris, glad to have you joining us today and really looking forward to our conversation. And likewise, Kim, if you could introduce yourself, please.
Hi, thanks for having me. So I'm Kim Somerville. I'm the Managing Director of Magpie Creative Communications. We specialise in creating healthier and happier communities, one person, one campaign at a time. And we do that with a rare blend of skills in behavioural insights, creative communications and community engagement. And much of our work is about reaching seldom heard groups in society. And we have some great partnership work with Chris and the team at My Language Connection, who help us break through language barriers and ensure that our communication, whether that's on the side of a bus or a video or a radio advert or a booklet, can reach anyone in any language.
Excellent. No, good stuff. Thank you very much for the introduction, and really looking forward to our conversation. So every week we look at some of the biggest issues and challenges in healthcare and in society, and what leaders like you guys are doing to address these challenges. So obviously health inequality and health inequalities comes up a lot in conversation, and we hear about this quite a lot with publications and announcements from leaders of the NHS. So Kim, to begin with, what is a health inequality? If you could help our viewers to understand that, and if we could look at that for a while.
Yeah, gosh, I mean, I'll try to answer that question because it's a huge subject. But health inequalities are ultimately about two things. Firstly, the differences in the status of people's health. And the term is also used to refer to the differences in the care that people receive and therefore the opportunities that they have to lead a healthy life. So both of these things, people's health and the care you receive, can contribute to health status. Health inequalities can therefore involve differences in things like life expectancy, the access to care, for example, which services you can have access to, whether that's GP or particular services within hospitals, particular bits of specialism, the quality and the experience of that care, so the levels of patient satisfaction. It also relates to differences in behavioural risks. So, for example, smoking rates. It relates to the wider determinants of health, which is a phrase which is pushed around. It involves things like quality of housing or air pollution. All of those things have an impact on our health. Who we're talking about when we talk about whom health inequalities affect the most. So the differences in health status and the things that determine it can be experienced by people grouped by a range of factors. So in England, for example, where I'm based, health inequalities are often analysed and addressed by policy across 4 types of factors. The first of those being socioeconomic factors, so for example, how much money you earn. The second being geography, so for example, whether you live in an urban or rural area. And the third being specific characteristics, including those protected by law, such as sex, ethnicity, or disability. And the fourth being those socially excluded groups. So, for example, people experiencing homelessness or those with language barriers. And those are the 4 key factors that are seen as the policy areas where people most experience the greatest gap in health inequalities. Finally, in the area of health inequalities that most interests me and the team here at Magpie, who specialise in behaviour change, is that we know that people's behaviour is a major determinant of how healthy you are, how healthy we are. So things like smoking, poor diet, harmful alcohol consumption, gambling addiction, people's level of physical inactivity, they're all leading risk factors that drive preventable ill health and premature death, effectively. So behavioural risks to health are more common in some parts of the population than others, and because we know that measures of deprivation are linked to income, gender and ethnicity. So that is a hopeful roundup of what we mean when we describe health inequalities, and something that I'm looking forward to talking about more today.
Definitely. Well, Kim, thank you. That was a very, very helpful introduction and summary to the theme. And so thank you very much for that. The 4 points that you raised are obviously fundamental for our understanding of the issue. And in particular, I think the comment you made about the avoidable aspects of health issues which come out of health inequalities is quite an important one. So, Chris, if we could develop that point that Kim touched on, how does language itself manifest as a health inequality? And if you could help us to understand that, that certainly isn't something which I automatically have an understanding of. I'm not sure if that's the kind of thing that the average person would get when you just talk about health and health issues.
Yeah, absolutely. Thank you, Barry, and thanks, Kim, for that definition. I think that was very, very helpful. I should also mention that Magpie actually hosted a webinar this morning, which was touching on some of these issues around health inequality, which was very, very interesting. So I do recommend people check that out. In terms of language, I think you're right, Barry. It's one of those things that's not, I suppose, doesn't immediately jump to people's minds when they think of health inequality. So I'll try to flesh that out with a few different examples. I think the first thing is important to say is that it's not just about languages other than English. It's not just about translation. We should bear in mind that 1 in 6 people in England, 1 in 4 people in Scotland have what's considered to be poor literacy skills in English. So I think when we talk about language, we should also think about the development of content in English to engage people, to engage patients, to enable access to services and things like that. And the sort of reading level that should be pitched at, the simplification of English, the avoidance of technical jargon, that kind of thing, which is more of a factor in technical documentation for the healthcare industry. But I think for people trying to access healthcare on a day-to-day basis, primary care, things like that, it's less understood. So I think that that's an important first point to make. I think then what kind of leads on from that is that 1 in 10 people now in the UK have a first language that is not English. So I think that's quite an important statistic. I think that number is going to obviously increase, and that raises all sorts of issues, not just around can they access information in their language, but also cultural issues about engagement. If you're going to build trust with people, you have to do it, really. It's not just a question of preference. You have to do it in their own language, in the language that they're most comfortable with. So even if they understand English, they'll almost certainly not engage in the same way with English as they would with their mother tongue. So we see that a lot with engaging people in primary care, for example. So one of the things we worked on with Magpie earlier this year was was a campaign to promote access to primary care and GP services for communities who don't speak English as their first language. And that was, that's a really interesting example. There's also cultural issues. There's cultural stigma regarding certain types of treatment, certain conditions, and the way that that's communicated and understood in different cultures is really something where language and translation, local color, if you like, from that language comes into play. Right down to things like the availability of information in pharmacy settings, so pharmacy labels. It's estimated that about 1.5 billion pounds is probably more than this now. So these figures were a few years out of date, but between adverse events from misdosage of medication, between wasted medicines that are not taken properly, and just non-adherence because people don't understand the instructions on how to take them. That costs about 1.5 billion to the country every year, to the NHS every year. So patient, some people call it patient compliance, patient adherence, and really sticking to the prescription, if you like, is directly linked to language. And we do see that with some of our other clients too, who specialize in providing services like that to the NHS. So it's there a lot, I think, but it's just one of those things that it doesn't immediately jump to mind unless you happen to be in the business that Kim's in.
Yeah, Chris, thank you very much. Very, very helpful additional information there. I certainly was not aware of did you say 1 in 10 people in the UK? For 1 in 10 people, what English is not their mother
language.
Yeah. And the theme of adherence, so to speak, in the pharma sector, of course, is vast. And often one hears, about the billions and billions that are lost due to doctors prescribing something to a patient and the patient, forgetting to take the prescription according to the requirements, or misplacing it, or getting bored with taking the antibiotic on day 7 when they should have gone to day 10 with it, and so forth and so on. And yet within that theme of adherence, what you just mentioned, which is, what do you want to call it, the language issues relating to doctors prescribing things to patients and the language complications for people relating to that, is yet another layer, which is obviously quite profound and, as you have highlighted, incredibly expensive for the country. And so lots of interesting information, which I suppose implies lots of superb opportunity for you guys to address these big challenges in healthcare, and to work with everybody in healthcare to achieve our vision of achieving better healthcare outcomes at lower cost and better results. Chris, could I ask you to elaborate a little bit more on a few of these things? Because this is such an important issue, and it's also not obvious, is it, when you think about it compared to a lot of other bits and pieces of healthcare. So, for example, could you talk further about how should language support be provided? You've highlighted some of these, challenges relating to language as a basic, what do you want to call it, issue in healthcare. But like I said, how should language support be provided, and who should be providing that? How does that work?
Yeah, no, that's a very interesting question. I think connected with that is actually what you're talking about, the pharmacies and adherence with prescriptions and so on. And I know just this week actually that the pharmacies are going to be given, local pharmacies are going to be given more power in terms of prescription and things like that. And I think the details to be finalized, but it'll be interesting to see how that maybe would connect in with, obviously that's getting closer to the local communities, having more responsibility within the local communities. So it'd be interesting to see how that would develop in terms of language. In terms of how should language support be provided and by whom, I think it's really about understanding, listening first and foremost, and then understanding the real voices, the lived experience of people in the communities. And I think that's where companies like Magpie really come into play, because they're there in the communities, listening, gathering information, picking up all those nuances of the lived experience.
Yes.
I think on a more on a sort of more direct level, native speakers have to be used for delivering language services of any kind. That's really important. People who have an understanding of for example, treatment area. When we were at the Giant Health show in December last year, and we had a great panel discussion with Kim and a few others as well, we talked about, it was really the particular focus there was around AI versus human in language, in the language space.
Yeah.
And I think that this is connected too, because it's all about nuance. It's all about picking up those sort of very fine details that are almost impossible to articulate. And I think AI generated content just doesn't do that, whether it's translation or whether it's content that's being generated in a language. Because I think behavioral change is all about nuance, right? It's all about it's all about the fine detail. Well, Kim will be able to articulate that better than me, but it's all about those fine details. I think the linguistic aspects of that are quite clear too.
Yes.
Yeah, I think if I can come in on that, just
Please.
I think, Chris, you're absolutely right, because when we're trying to communicate a very sensitive topic or something that's really nuanced in behavior change. So, for example, telling people not to smoke we know that doesn't work. Presenting people with the positives and the benefits of that and creating a social norm that 88% of people on this high street don't smoke is a much more positive way of encouraging people not to smoke on the high street.
Yes.
As humans, we want to follow the social norm.
Yes.
One of our health campaigns that was translated with a low budget by a client using AI generated translation, translated into Arabic, and a member of we tested that on the public, and an Arabic speaking member of the public said, it doesn't make any sense.
Oh no.
And we went to my language connection, at which point native Arabic speakers were able to translate the nuance of the important parts of language where we were trying to get across a message to change behavior. This was actually about breast cancer screening.
Okay.
And it was really important to encourage women of a certain age in certain communities to go to their breast screening appointments.
Absolutely. And perhaps a bit of a delicate subject in terms of how it is communicated and the messages.
Certainly, and culturally, and in many communities, something that wasn't the norm.
Yeah.
And so being able to work together on ensuring that the language was just right, that we didn't lose the behavioral science behind that, has been really, really important. And that's a prime example of language being a barrier and creating a greater health inequality, because if the right information can't get to the right person to go and get your breast screens,
how's anything going to be done?
Cancer,
yes.
That's the reason why we know that women from certain groups are more likely to get diagnosed with breast cancer if they have access to the right information. So I think that AI versus real voices and native speakers is really important to break down those barriers.
Yes, it's a good point. And of course, not a minute goes by these days without AI being headline news with all of the new large language models and so forth and so on, and the growth of that technology. But obviously, Chris, you've raised a very good point there, and thanks, Kim, for adding to that. There's an enormous amount of nuance in healthcare diagnosis and in treatment, isn't there? And it's certainly not just about the very, very most, if you will, overt written language that comes across. Although I have to admit, when it comes to AI, I hope some AI bot can take over managing my emails, because I'm certainly not doing a very good job at that with or without all my language nuance capability. But joking aside, it's a good point. There are a lot of superficial discussions, mainly 5 years ago. Hopefully, a lot of that is dying down now. That AI and machine learning and robots are going to take over and replace doctors and so forth and so on. So I'm suggesting maybe they will, but that might be 200 or 300 years from now, if the species lasts that long. And in the meantime, there's an awful lot of human opportunity for all of us to do an awful lot more in developing better healthcare and getting better outcomes for the whole population. You guys, this is such an interesting topic. I'm also wondering, though, and Kim, maybe you could lead on this, but also Chris, your views. We've talked about language. We've talked about prescriptions, with, of course, come with labels on the pill bottle and instructions and leaflets on the counter at at the pharmacy office, at the chemist's shop, and things like this. So that's written language. Are there other issues though? What is there beyond the written word? What is there beyond, just, whatever, text on website pages and wording in emails and leaflets that your GP hands out to you? What beyond the written word, what other methods can be used to break down these healthcare barriers that are related to the big themes we've been talking about?
Do you want to kick that off, Chris? Because I'm aware that things like engagement we've worked together on.
Absolutely, yeah, exactly. So I think I think that the written word it goes so far, but I think you also have to engage with people in the way that they're engaging with the world, in the way that they're consuming content, if you like.
Sure.
And one of the big themes in not only in healthcare but across the whole world, really across every industry, is the explosion of video content, multimedia content, so video and audio, and that's something we've seen an awful lot of companies, really pick up, as opposed to the written word, because in a sense, yes, people still translate, user manuals and things like that, but no one really reads them. People go to if I need to find out how to do something, I go and watch a video on YouTube, or
absolutely. No, I'm a graduate of the University of YouTube.
Yeah,
absolutely.
Exactly. And so we've worked on a lot of kind of engagement pieces with Magpie.
Nice.
In terms of amplifying local voices in local accents, even. So you may have an Urdu speaker, for example, but with a West Yorkshire accent, and that's things like that. Really getting into the nuance of the voice artists and things like that. Subtitling of animations, British Sign Language as well. We've worked on sign. So again, thinking about language not just in terms of translations, but in terms of the source language, in terms of British Sign Language, other ways of communicating, and we've covered off those areas too. And I think it's really, for us, encouraging and satisfying to see how the work that we're doing provides that access and engagement for people, and ultimately helps to drive better health outcomes. So it's
yeah, exactly. No, that's so very interesting. Kim, can you develop that with us further?
Well, I was just thinking of another example that we've worked on together, talking of audio actually, which was encouraging people to have COVID safe behaviour. And we, in order to reach through any digital barriers, as in people that weren't able to access emails or see messages around COVID behaviour, we published a booklet that got sent to over 500,000 homes around Yorkshire.
Wow.
That booklet was in English, but it was tailored to each postcode. So, hello, Kirklees, this is your booklet. Hello, Wakefield. So it felt very personal. And then in the back of that booklet were 12 different QR codes that you could scan and then listen to an audio guide of that booklet. And that and those different QR codes led to 12 different languages. So rather than printing it in multiple languages, people could then listen to the audio file. We know, breaks through the written word. And more importantly, and a marketer loves this, they love being able to track how many people have done things. We can then track how many people downloaded what audio guide. And we know that over 700 people listened to that audio guide in particular languages that wouldn't have had access to that information via anything else
at all.
So that was a bespoke government-funded campaign, but we know that did transcend health barriers.
Exactly.
Which is
very interesting.
And we know that the raise of the QR code came back again over the COVID period. But we've done all kinds of really quite creative things to try and break through the written word and get health messages out there. So, for example, we know that people missing GP appointments is a big issue for the NHS.
Yep.
And evidence shows, or did at the time when we ran this campaign, that the people most likely to miss a GP appointment are busy commuters that work in the city. I'm not saying that's the case now. This was a pre-COVID campaign. So on a very low budget, we often are working on lower budgets with public funding. We sent out memory joggers around big cities, and these were people dressed in big purple suits that had memory boards on them that said, "Don't forget your GP appointment. Got an appointment today, cancel it." And there was a hashtag that was "cancel it now." to remind people not to miss their appointment. And these memory joggers ran around the city at key train stations and points like that.
Right.
And if you think about it, in a noisy world where there's tons of messages to get across, sometimes you just got to try out these alternative formats.
Yes.
And we've done things like rain graffiti. So we run a campaign called Painkillers Don't Exist, which is to help people try and seek help when they're addicted to long-term painkillers.
Wow.
Or long-term pain reduction medication.
Yes.
And this PT shows up on the ground outside pharmacies at key points. And, living in the UK, we get a lot of rain, so that appears when the rain comes. And we've run antibiotics campaigns. We run a campaign called Seriously, which is about the antibiotic resistance, and reminding people to do things like finish their course of antibiotics, or when to take antibiotics, when to ask for them, when not. And we filled stadiums in Sunderland with big red hands of people saying,
Nice.
Take antibiotics seriously.
Nice.
There are different ways to get across messages that don't
exactly.
require that written word. So
Yes. Yeah. It's way, way, way beyond the leaflet that the GP hands out, which I suppose most people don't even read.
Yeah, a combination, with all good marketing solutions are multifaceted campaigns that use different channels.
Yes.
One thing is not just thinking about different channels, but thinking about the different languages needed for the right audiences through those channels.
Mm-hmm. What are some, what do you want to call it? I don't know if lessons learned is too grandiose of a concept, but has there been an evolution? What have you guys seen over the past 5 years? Are there recent ways of communicating successfully that are known to be working to address the health inequalities which weren't done 5 years ago, or is it still just try everything and keep trying?
I think there's been a massive system-wide learning in this area over the last decade.
Yes.
And one of those biggest areas has been collaboration between local authorities and the NHS and the voluntary sector. COVID just brought that on so much quicker than it would have happened otherwise.
Nice.
But I feel, I've worked in this area for over 10 years in relation to health and marketing. And what I've seen is the hyper-targeted use of spend in marketing and making sure it reaches the right audiences.
Yeah.
By that I mean, rather than just saying, well, we put out an advert on Twitter in English, or we placed a YouTube video out there,
Yeah.
saying, well, actually, my audience is going to be walking along that street at this time and this language, and they speak this language. I'm going to target a TikTok advert because that's the right person as they walk down the street at that time. So we're seeing much better return on investment on key messages.
Nice.
I think greater collaboration is the first answer to that question. And then the second is more hyper-targeted use of messaging at the right audiences at the right time.
Yeah. Yeah. The fine-tuning of those channels, so to speak. Yeah. Oh, Kim, that's fascinating. And good to hear, obviously, with the successful progress in that. How about you, Chris? Any views about, what's changed over the years? And also, second question to follow from that, which is, where do you see this going and opportunities over the next few years?
Yeah, of course. I think there's a lot of good points there. I think one of the things that I've definitely seen across the piece really in the past, since COVID really, is the acceleration of everything, acceleration of all timelines. So everything has to be done a lot quicker.
Right.
We work a lot with the pharma industry. So everything in pharma now is done on such a crunch timeline. And I think when it comes to, engaging communities and encouraging behavior, definitely a lot more video and animation. So gamification has become a big theme in healthcare. We've seen a lot more animations and kind of the traditional gaming localization side of things coming into healthcare, which is definitely something that's on the increase, and I think will continue because again, it's how do people, especially younger people, and as younger people get older, how are they used to engaging with the world?
Well, exactly.
So I would say those are definitely the main areas that I've seen in the past few years. I think everything just sped up and become more multimedia.
Super. Hey, well, look at we have a few minutes left, and so just wanted to find out if you guys have any additional things you'd like to add, and also if there's any other examples of your partnership and examples of what you guys have done in this theme, which I think our viewers would find really interesting. Kim, do you want to highlight any other examples of collaboration you guys have done?
Yeah, I'm trying to think. I think actually this relates really well to the news this week. Chris just mentioned it before. You know, the headlines are pharmacies able to give out more prescriptions at the moment, but
Right.
you know, of course, we're referring to the primary care recovery plan, the announcement that came out from government this week. We've been running a campaign together for over 6 months now, and it's called "It's a GP Practice Thing." It started in Bradford in West Yorkshire, and it's now been taken over by the whole of West Yorkshire, the ICB in that area. And
Nice.
it's about when to access the right healthcare service at the right time. So it might, and really educating people on, and there's been a massive culture and behaviour change around this since COVID, that
Yep.
you don't go to your GP for everything now. There's a whole system that can support you, whether that's the practice nurse, the pharmacist, the physio, whether that's the receptionist that can help point you in the right direction when you phone up,
Mm-hmm.
and understanding the capability, the opportunity, and the motivation of people to be able to grasp this total change in the way that we access health support now.
Exactly.
Mega, actually. So,
Yeah.
so we ran a load of focus groups and insight with people in Bradford, asking them what they understood, what were the barriers to them accessing or understanding now how to use their GP surgery in the right way, and My Language Connection have got people that will help on the ground, that will come out and attend those focus groups with you, that
Nice.
will translate those focus groups, that will be the native speaker in the room. We'd always try and do that alongside community groups so that it's a safe
Yes.
space.
Yeah.
And then My Language Connection on the back of that have also, once the communication has been developed,
Yeah.
helped to translate animations into multiple languages. And I'll provide a link actually, because on the website the video is now available in multiple languages, from Punjabi to Polish.
Brilliant.
Can be listened to, and actually there's a British Sign Language version. And even the English language version is run through a reader to make sure that we've got the correct reading age level, because you know, we don't want to use, and it is interesting because working through that campaign, we work with really very, very clever health professionals, but the language that's used sometimes is just not accessible to the patient.
Right.
Being able to talk about primary care and access to primary care, it doesn't mean anything to Mohammed that wants to make a call, or Mary that wants to call. You know, they don't understand what that means. So
Well, exactly.
working together to both help listen to the audience and then also communicate those changes to the audience has been key.
Yeah, definitely. I think the only thing I would add on to that is, I think the diversity of languages, the wide range of languages that we've worked on together. So Kim mentioned a couple there, but you know, Pashto and Bengali and Polish and Romanian and Arabic and Urdu and various others. I think it reminds us as well of, you know, that figure we had, 1 in 10 people in the UK
Yes.
who don't have English as a native language. There's a lot of linguistic richness around us, and I think we don't always realize that. So it was interesting.
Yeah, no, absolutely, Chris. Thank you. And Kim, thank you very much. Hey, well, like I said, I hope you guys don't mind, but we're going to have to wrap up in a few minutes. And any final closing comments you'd like to make, Kim?
I think really we all just want a happier and healthy world, don't we? And
100%. Yeah.
everybody around us, and understanding how we can all work together to break down any inequalities is really key in the industry that we work in. And so,
Yes.
you know, if you're not sure, or you want that advice on how to best communicate to diverse audiences, please do get in touch with myself and Chris.
Absolutely.
We'd love to be able to help you with that.
Excellent. Yeah, thank you, Kim. And for the benefit of all of our viewers around the world, there'll be links to Kim and her business Magpie, and of course links to Chris and his business MLC in our YouTube channel. And that theme of these, the broad theme of health inequalities, but of course the sub-theme of language issues is so vast. And some of the statistics that you guys have highlighted, in particular the cost to the country, there's a huge opportunity here, isn't there, to substantially improve the health and well-being of a significant part of the population, and the knock-on effects of that population being healthier in terms of contribution to society, of course, is vast. So there's a lot at play here in an area that I didn't know too much about, and I've learned a lot today, and so very, very interesting. Chris, anything else you'd like to add before we wrap up?
Yeah, I think one thing just to highlight is that, when people think of language and they think of translating content or whatever it might be into different languages, they often think of, exporting things abroad or selling things abroad or
Yes,
people in other countries. We're talking about here in the UK, predominantly we're talking about here in the UK in our partnership with Magpie and engaging communities here in different regions. So again, I think it's maybe a different perspective that people don't have. They don't necessarily think, when they think of translation, they think of, I'm going to sell something in France or whatever it might be.
that's right.
This is here, this is within our communities. And I think it's really important that we get it right.
No, that's a very, very good point. I think most people, I agree with you. If you hear about a business that provides language translation, that's about exporting something, isn't it? Or helping Chinese businesses to make labels in English for marketing product here. But we're talking about the health of a significant population here in the UK. And so that's a very important insight. Thanks, Chris, for sharing that.
Thank you.
Look, I found this conversation incredibly interesting, and we're grateful, Kim, for your time. Thank you. And likewise, Chris, thank you. And thanks to MLC for your generous and substantial support as a sponsor of Giant Health. We appreciate that. I'm glad, Kim, that you guys were able to come to the Giant Health event last year, and certainly hope that you can all join us this year.
Yeah.
And so that has been this week's episode of Giant's Healthy Innovators TV. Thanks to Kim Somerville from Magpie. And thanks to Chris McCord from My Language Connection, MLC. Love having you guys on board. And perhaps what we could do is have a follow-up episode, maybe half a year from now, and continue to help all of our listeners learn more about these very important subjects. And also love to hear more case studies and success from your partnership. So love to invite you back. Thanks again, Chris. Thanks, Kim. So this has been this week's episode of Giant's Healthy Innovators TV. A reminder, if you find these episodes interesting and useful, remember to like and subscribe on our YouTube channel. You can learn more about the annual Giant Health event on our website, which is www.giant.health. We'd love to hear from all of our viewers, so don't hesitate to contact us on the website. We'll also provide you with contact details for Kim and for Chris. And we hope if you guys have questions, you'll direct them to them. And love to invite everybody who's been viewing to engage with our valuable collaborators, Kim and Chris. Thanks very much, everyone.